My Lords, I feel like I must begin with an aside, which is a reflection on how this debate illustrates how outdated our political frames, indeed the arrangement of our political furniture is, with the idea that we have two sides of politics. It clearly is not reflective of the way our politics is operating now. And I have to respond, speaking after the Noble Lord Dobbs, who asked how many deaths from Omicron. He really appears to have learnt nothing from the past 2 years about exponential spread of viruses and the delay between infection, hospitalisation and death. I caught the number 29 bus down this morning, and I saw, again, as I've seen through pretty well all of the last 2 years, the public ahead of and in advance of where the government thought they might be. The bus was largely empty. Everyone on it was masked and was wearing a mask properly. And I think I was seeking to speak after the Noble Lord Thomas of Gresford because I wanted to say how honoured I would have been to do that and to express my respect for his presence and his speech here today. And I think it is an utter rebuttal of the claim from the Noble Lord Robotham that we're all free to make our own decisions, because none of us are free to choose whether or not to breathe. And we all have to breathe the air in this chamber. We have to breathe the air wherever we go. Which brings me to the first of the 2 points that I want to make this morning, which is we could be debating some very different SIs today, some very different SIs that would be based on the science, some very different SIs that would be based on a response I had from the Noble Lord Bethell when he was sitting in the seat where the Noble Lord the Minister is sitting now in July. And the Noble Lord Bethell said then, and I quote, "Ventilation is critical, but it is also difficult." Now, what we could be debating today, instead of these SIs, would be SIs that allowed for an emergency scheme for premises, entertainment premises, concert halls, theatres, to have on the door, as restaurants do now, a rating for food health. They could have on the door a rating for ventilation. And people would be able to choose then how they went, which venues they went into, based on the really real measure of the risk that that venue presents. We could see that rating that shows we could see another SI that would have an emergency program, as the National Education Union has been calling for many, many months. Installation not just of carbon dioxide meters in schools, but actually of ventilation, filtration systems in schools. We're seeing isolated trials popping up, but we're not seeing those things. But of course we can't be seeing emergency SIs like that, because those are things that would take many months to implement, that in long-term schemes. But they're long-term schemes that should have been implemented many months ago. I go through a British Medical Journal editorial from July. It says that workplaces, healthcare facilities and education providers must pay greater attention to the cleanliness of the air. This is an editorial written by world-leading microbiologists and engineers. So, my Lords, what we've seen over the past 2 years is a public which has done amazing things, has shown an amazing grasp of the reality and has adapted its behaviour accordingly. Sadly, we've seen a government which hasn't lived up to its responsibilities and has been focused absolutely, totally on one prong of defence, which is vaccination. Now, I absolutely agree with the huge drive for vaccination. Like many members of your Lordship's House I've spoken to, my booster is booked for next Monday. I'm holding out for that, hoping to survive to that point. But I do want to get to the other SI that we are facing here, which is the SI on vaccine passports. Now, I think the Noble Lady Baroness Walmsley and indeed the Noble Lord Scriven made some very powerful points about the medical faults in this. I want to pick up another point and another concern about this, a concern that I raised also yesterday when we were talking about vaccination for deployment in health and care, that if we send a message to people that this is something we have to force you to do, vaccination is something we have to force people to do, then that resists building, it has a risk of building resistance. That has a risk of being counterproductive. Where do we actually want to get to? We want to get to a situation where every person for whom it is medically possible is vaccinated, and they've chosen to be vaccinated. That requires fairly large ask, trust in the government, but above all it requires a program of education, a program of outreach, something we clearly have not seen nearly enough of. Now, in the other place, the Green MP Caroline Lucas, whilst expressing great reluctance, voted with those opposing the vaccine passport SI we have before us. I must admit I'm feeling rather torn at the moment, because I think this vaccine passport SI is dangerous and counterproductive, but I do find myself feeling extremely uncomfortable with people making very different arguments grouped in the same space, so I haven't quite decided what to do. But what I do want to see is a government that's allowing people to keep themselves safe by actually taking on what Lord Bethell accepted in July was a crucial issue, which is ventilation. I also want to pick up points, particularly from the noble lady Baroness Hayman, on the global scale. No one is safe until everyone is safe. The government is not doing nearly enough to get vaccines around the world. We will see more risks. But I also want to pick up how people are able to keep themselves safe, which is we are going to see people, whatever the government passes, not going out into entertainment venues. We are going to see people rearranging their lives. That means people need public support, those businesses need support, and here I agree with the noble Lord Venkathra. And also, we need people able to keep other people safe, which means proper and full sickness payments when people need to be able to self-isolate as they should be.